So you've completed the pre-consultation online course. You know you want to have plastic surgery. So you come on to see me for a face-to-face consultation. We discuss the surgeries together and we decide what surgeries are in your best interests. You sign up for surgery, and what's the next step? Well, the next step is to consider pre-operative testing. So what is that? Well, basically, anybody who is over 40 needs clearance from your primary care physician. So if you're over 40 years old and you're considering cosmetic surgery, you do need to see your primary care physician, or we can refer you to somebody to undergo pre-operative testing. This testing is all very basic, and it's just simple things like making sure you don't have a bleeding problem, you're not anemic, you don't have a urinary tract infection, and your heart will tolerate surgery. All basic stuff. And we can go over the details with you when you meet with my patient coordinator after your face-to-face consultation. A couple of things that you need to know of as well, though, is if you are on multiple psychiatric medications, we do need a clearance from your psychiatrist prior to undergoing surgery. Okay, so this is mandatory. You know, there are a lot of patients who are on one antidepressant and it's given by their primary care physician, and that's not necessarily what we're looking at. But if you're on multiple, more than one psychiatric medication, then that is something that I do need to have you cleared by your psychiatrist, because most of that time, if you're on more than one medication, quite often a psychiatrist is the one treating you, and we want to make sure that having cosmetic plastic surgery may not cause a problem for you. There's always a risk of potential complications, and I would hate to have a complication cause a psychiatric issue for you that could set you back maybe in your recovery or kind of where you're at with your psychiatric treatments. Okay. Also, depending on your medical history, you may need clearance from a cardiologist, a hematologist, a rheumatologist, or others. So for example, if you have a previous history of heart disease, prior to any cosmetic surgery, we need to get you cleared by a cardiologist. If you've got a clotting or a bleeding disorder, then we need to have you seen by a hematologist to get cleared and to get recommendations for that. If you've got autoimmune disease, okay, if you're on, let's say, steroids, then seeing your rheumatologist is important because we want to make sure that that is not going to be a problem for us. And there are potential other issues that you may need to get cleared for, and those we can discuss at the time of your face-to-face consultation. But to put it simply, if you're over 40, at minimum, you need to see your primary care physician, or we can refer you to somebody to get cleared. If you're on multiple psychiatric medications, a psychiatric clearance is necessary. Based also off your pre-medical history, or in your medical history, you may also need clearance from a different type of specialist as well. And once again, this is something we can talk about at your face-to-face consultation. So I hope this is helpful for you so that you can get ready now that your consultation, face-to-face consultation has been completed and you're going to consider having surgery. Getting that preoperative testing ready prior to your preoperative appointment is super important. So the next step would be the preoperative appointment, so I encourage you to take a peek at that next.